Okay, we're going to do an occipital nerve block on this patient, and we're going to start on the right side here. And what we're going to be doing is putting some local anesthetic around the greater and lesser occipital nerves. So in order to localize these nerve endings, we want to look at the skull and find the most prominent posterior protrusion in the midline, and that's called the inion, which is nicely shown on this patient. So keeping one finger on the inion, the other bony landmark is the mastoid process. So we find the mastoid process just behind the ear, the tip of the mastoid process. So now if you drew a line between these 2 points along the nuchal ridge in the midpoint, that's our main landmark for localizing our nerve endings, because from this midpoint, on the medial edge here is the greater occipital nerve, and on the lateral edge is the lesser occipital nerve. Another way of looking at this is that these nerves lie a third of the way along this line for the lesser and 2/3 of the way along the line for the greater. So, mastoid tip, inion, midpoint. And I'm going to infiltrate on either sides of the midpoint, first for the greater and secondly for the lesser occipital nerve. We're going to use a 27 gauge 1-inch needle, and when we do the injections we want to make sure that we penetrate down to the periosteum. So angling the needle upwards and making sure that the needle is snug against the periosteum. Support the needle, pull back to make sure there's no blood flush, and I'm going to inject a full 1 cc of Marcaine, and this is 0.5% Marcaine without any epinephrine. You'll notice that the fluid has expanded the soft tissue, and the patient will feel a pressure-like sensation from that injection. Now for our lesser occipital nerve, we're going to go laterally, and we're going to repeat this, again angling the needle up and making sure that we hit the periosteum. That gets us close to the nerve, pulling back for the blood flush, and then injecting 1 cc of Marcaine at this point. I like to finish the procedure with a third injection that I do just suboccipitally to capture any of the fibers that are traveling up from the splenius capitis as they extend up over the nuchal ridge to get to the skull. So in this suboccipital location we won't be hitting periosteum, and we're going to inject just 0.5 cc of Marcaine at this point. As you'll notice, we now have fluid expanding this entire area, and that will capture any branches of the greater and lesser occipital nerve, which will lead to a numb sensation that extends from the injection point all the way up to the vertex of the head. The occipital nerves supply this area of skin.